A 35-year-old African American woman pregnant to her gynecologist because of the lower abdominal pain. She is diagnosed with an 8-week gestational age ectopic pregnancy. She has an ectopic pregnancy, which means that the fertilization and the formation of embryo start in the fallopian tube, and medically treated. Okay, she's treated. A few months later, she returned complaining of the vaginal bleeding. Now she has a vaginal bleeding and is diagnosed with gestational choriocarcinoma. Her physician chose the same drug to treat this cancer that he used to treat her ectopic pregnancy. Which of the following drug is indicated in the treatment of both ectopic pregnancy and gestational choriocarcinoma? So methotrexate, mifepristone, misoprostol, rifampicin, tamoxifen. So I know which drug that is. The drug which is used, it is methotrexate, because the action of methotrexate is that it inhibits the formation of folic acid. Okay, so it is used in the anti-cancer. It is used as an anti-cancer medication because it inhibits the hyperplasia of the cell, and it inhibits the growth of the development of the cell. So folic acid is very important for the development of the embryo, so it inhibits the formation by inhibiting an enzyme that is called as dihydrofolate reductase. Okay, once this dihydrofolate reductase is inhibited by methotrexate, there is no formation of the folic acid. Okay, this one is inhibited. So it is used in both case of cancer and in both case of the ectopic pregnancy. So what about the gestational choriocarcinoma? So whenever the embryo is formed, okay, there is the outer covering that is called trophoblast, sensortrophoblast, cytotrophoblast. Okay, this is the chorionic layer of the embryo. Once there is a tumor of this layer, trophoblastic layer, okay, it's called as choriocarcinoma, and it is a disease of gestational trophoblastic disease. So it is called as gestational trophoblastic disease. One of the gestational trophoblastic diseases is the choriocarcinoma, and this excessive growth of the cell here is inhibited by the methotrexate. So what about the mifepristone? So mifepristone is an analog of the we can say it is a partial prostaglandin agonist. Okay, and this is also used in case of some cancer. Okay, and it also used in case of the first trimester medical abortion. Rather, it is not used in the ectopic pregnancy. So this is, it has no use in ectopic pregnancy, no use. Okay, no use in ectopic pregnancy. Rather it used in abortion. It is used in first trimester abortion. First trimester abortion. First trimester abortion. Okay, it's enough for that. And what about the misoprostol? Misoprostol is a medication. It is a synthetic analog of the prostaglandin. It promotes the strong contraction of the uterus, and it also used in case of the abortion. Okay, it also used in case of the first trimester abortion, and it is an analog of the prostaglandin. And prostaglandin, you know, it is the cause the uterine contraction. So it caused the uterine contraction, a strong uterine contraction. So that's why it is also used in first trimester abortion, and it is also has no effect in case of the gestational trophoblastic diseases and ectopic pregnancy. And what about the rifampicin? And everybody knows about the rifampicin. The rifampicin is an anti-tuberculosis medication. So it is used in case of tuberculosis, so it is anti-tuberculosis drug. And what about that of the tamoxifen? Tamoxifen is a partial estrogen agonist that is used to treat the estrogen dependent cancer of the breast. It is not indicated for the treatment of the ectopic pregnancy or the that of the gestational trophoblastic diseases. So it is used in case of the estrogen dependent breast cancers, breast cancer, because it is an analog of the estrogen. So the best choice that is used in both cases, in case of gestational trophoblastic diseases like choriocarcinoma, and also using ectopic pregnancy. The drug is methotrexate. Thank you.